Okay, guys, we are live. Good evening to everyone. My name is Dr. Silverman, and this is one of our traditional doctor series. You know, for easy sake, I call it science presentations. This is not about as much as science because we really don't want to overwhelm you. However, every one of you need to believe that you have our back in terms of medical research and science. So, as I said, my name is Dr. Silverman, and I practice medicine in Alberta, Canada, and I practice surgical pathology. Despite that this is my home office, you see there's a microscope here. And in fact, today I was working from home. My cat was sick, so I was diagnosing cancers from home. So I'm involved with LifeVantage since 2013. And it's interesting, today my co-presenter is an amazing Dr. Pratiksha Gandhi. And there's a commonality between us. And the commonality is called prevention. So despite that, I am a breast cancer pathologist, published, a consultant and stuff. Diagnosing breast cancers is not a legacy. Diagnosing cancers is a power. And breaking bad news, delivering bad news is not changing the world. Prevention is changing the world. And Dr. Pratiksha Gandhi, I will tell you about her credentials a little bit later. But it's also an amazing story because she doesn't need to be a preventative cardiologist. She can be interventional cardiologist. And again, breaking bad news, your husband has a heart attack, I'm going to take him to the cath lab. And after then, you don't know what's going to happen. So the best cure of the disease is the disease prevention. And that's, in LifeVantage, we don't cure, mitigate disease, but the most important thing, and that's what Dr. Gandhi is going to be talking to you about, how to address the issue of if we protect our vessels, well, inadvertently, it's going to prevent cardiovascular disease. And if we, from my teaching, if we get to the bottom line of oxidative stress or removing or cleaning cellular garbage per se, well, cancer doesn't have an option to occur. Just there is no way that cancer can occur in a genuinely healthy cell. So, and that's why it's so exciting what we do and why we do it through LifeVantage, because as medical doctors, we spread the word of health through LifeVantage. But please, again, don't get me wrong. We are business builders because I cannot talk to 1,000 people, but I can teach my business partners, and then they can distribute the word of health. And the same is going to happen with Dr. Pratiksha Gandhi's team. We spread the word of health by numbers, by multiplying. That's how we convey the message. Dr. Gandhi, an incredible honor to co-present today with a global healthcare leader, an MD, a multiple MD. I believe she's practicing United States and India. She is a serial entrepreneur. I like the word serial entrepreneur. Preventative cardiologist. She is an author of books, a speaker, researcher, and she is India's first woman preventative cardiologist, recognized none other by the President of India. You see who we have today? Now, she pioneers, obviously, in the concept of preventative and non-invasive cardiology, and she discovered, and she is running the Preventative Non-Invasive Institute of Cardiology, which initially she established, and she's a founder of this institute, and she established it. I guess people in Arizona don't understand that I am on the presentation. Sorry about that. But now she runs basically two arms of this institute, one in India and one in the United States of America. So as we know, the death rate number one belongs to cardiovascular diseases. So it's our duty to prevent cardiovascular diseases. So let me start with sharing my screen, and then Dr. Gandhi is going to share hers. Sorry, guys. We were practicing. Even doctors practice. So, oh, and somebody's texting me on the wrong number. Actually calling. Why, guys, what separates LifeVantage? And why are we talking prevention? Because we're talking nutrigenomics. Think of the word nutrigenomics. We can break it into two parts. It's nutrition into genes. Now, it's up to you and it's up to me what kind of nutrition I'm applying to my genes. Mind you, our genome is about 20,000 genes. Lately, I've heard 23,000 genes. And guess what? Only 1.5 to 2% are coded, meaning that nothing we can do about it. Can you imagine that over 90% of my genes are actually modifiable? So I can play with them. And I can play with them two ways. I can play with them in a good way, and I can play with them in a bad way. So nutrigenomics, so let's modify our genes in a good way. Why is it so important to modify our genes? Because those genes, they make signals to make proteins or enzymes. And that is those biochemical structures that run our cells. And again, some of these enzymes, they affect our cells in an adverse way, and that's what we want to prevent. And some of these enzymes, they absolutely act on our cells in a positive, constructive way to keep us not only healthy, but to keep us young and functional. Why are we so excited about free radicals? I just came back from the conference, Environmental Health for Healthcare Practitioners. And there was a notion. Every toxin is a free radical, and every free radical is a toxin. What is a free radical? So you obviously understand the concept of toxins. We know that. Let's say I'm a pathologist. I work with toxins. I work with formalin. So obviously I need to take LifeVantage products to eliminate that stuff. So free radical is a toxin, a molecule, a structure, or something that misses its own particle or misses an electron and wants it back in a hurry, and wants it back from anything that it's on its way. And when that free radical gets back this electron, it harms or damages the cells. So that's what we're talking about. We're trying to get our hands on prevention of that free radical, constant, relentless free radical barrage, which is called oxidative stress. And as you see on this slide, for us doctors, we deal with disease. We don't deal with normality. And disease, it's dis-ease. And something is missing. It's either too much of a negative stimuli or noxious stimuli or toxins, or too little of eliminating them, or not enough prevention. So that is that disbalance. It's like disbalance. We need balance in everything. Oxidative stress-free radical damage. As I mentioned, why it is so exciting to have Dr. Gandhi, because she's going to talk to us about one system. On this slide, you see that basically every major organs, every major functional system are linked to, in adverse manner, are linked to oxidative stress or free radical damage. And from every organ or every system, you can build those chronic diseases. It's all about chronicity and eliminating that chronicity, because the direct link is free radical damage equals oxidative stress. Oxidative stress leads to chronic inflammation. Chronic inflammation is a culprit of our medical society, of our medical community. And every chronic inflammation, you can divide into every organ, basically attach the suffix itis, and you get your carditis, duodenitis, mastitis, and it leads to chronic inflammation. And it's interesting when we start dealing with chronic inflammation, when we, how many people that one has rheumatoid arthritis? Not enough. When there's chronicity, there is a chronicity to different organs. So if someone has a diabetes, so that person probably has a liver dysfunction. From a liver dysfunction, that person probably has a weight problem and a high blood pressure problem. A person with rheumatoid arthritis probably has a problem with maybe bowel, like ulcerative colitis, Crohn's disease, multiple sclerosis. So it never comes as just one problem. It comes in a multitude of chronic problems, which are all related to this guy, oxidative stress. Oh yeah, we hit 100 people. So now, please do not write on my slides. So let's get to the root cause and the bottom of it. Yes, guys, we have a winner. Whether you like it or not, we do have a winner. NRF2 Protandim is one of those winners, but we have it. So we're talking about NRF2 activation. And my husband just joined me. He just decided to join me. This is in a live presentation. So NRF2 Protandim, the simple combination of 5 herbs or extracts of these herbs, and some of them are so familiar to Dr. Gandhi because turmeric extract, so indigenously known in India, bacopa extract, known in Canada as rosehip, but in India as brahmi, so known for centuries as the healing remedy, ashwagandha root, something that used for depression, sexual dysfunction, cardiovascular disease, immune system, adrenal boost, again, used in India for centuries. And milk thistle, which is used everywhere and everybody knows it as the weed. So the combination, the synergistically concocted combination of these herbs created this product, which is called NRF2 Protandim. It's built on synergy patterns. What is NRF2? Well, NRF2, guys, is a key to cellular health. So if NRF2 is a key to cellular health, right? So this is how we unlock that key with NRF2 Protandim. So why am I so excited about NRF2? Because, again, it's a key. So what does it do? Do you think that this NRF2 opens one door? Oh, no. It's called nuclear transcription factor. Think about it. Nuclear means it goes into the nucleus. Transcription means that it actually transcribes the genes. So it gives that NRF2 holds the key to the transcription what is called survivor genes. Lately it was said over 900 survivor genes are described. And if they're survivor genes, obviously these are good things. So the category of these survivor genes include anti-inflammatory, we were just discussing chronic inflammation, anti-cancer, and the genes that turn on our own antioxidants. And those antioxidants are going to repel the free radicals. Don't get me wrong. You need to eat right. You need to eat your nutrient-dense foods, your green foods, your fruits and vegetables, your amazing essential fatty acid, on and on and on. However, it's not enough. You need your cellular, your own antioxidation, and NRF2 is the key. So, as I said, it's a master rheostat, and I'm so excited. Again, I just came back from the second in the world NRF2 conference targeting chronic diseases. That's where we are. The title of the conference is NRF2 Targeting Chronic Diseases. We were talking atherosclerosis, multiple sclerosis. We were talking NRF2 and cancer, fibromyalgia, and different other things. Diabetes, liver disease. So, I'm going to mention only one antioxidant here, which is critically important. When I mentioned to you that NRF2 unlocks the genes that turn on our own antioxidant, one of them is called a master antioxidant. It is called glutathione. The importance of glutathione health or the glutathione volume concentration is critical because the decrease in glutathione is directly linked to heart attacks, cerebrovascular accidents, or lack of it, not glutathione more, but the lack of it. Glutathione and brain health goes absolutely side by side. Not enough glutathione, the brain is not going to be functioning right. So having NRF2 pretandum, knowing that it upregulates glutathione gene via NRF2 activation, increasing that glutathione production by 3 to 4-fold, that is absolutely amazing. So now it's my time to stop share and leave all the floor to incredible Dr. Gandhi, please. Oh, unmute yourself, unmute. Okay.
Yes, hello everyone. I'm very, very excited. All great energy out here. And thanks to Dr. Silverman. She has done all actually the difficult part for me and made it so easy talking about NRF2 and oxidative stress and the science. Don't worry, I'm not going to talk anything in some cardiology jargons. What we're going to share here today is, because what I understand is there are this is like for all the people in the world, and a lot of people who are non-medical are over here. So, and that is what I'm excited in Life Vantage, that anyone who is interested in health and wellness is over here. And I'm so happy to share my message today. So since I'm new and I have great and amazing team, I'm going to a little bit put up on what I've been doing as a preventative cardiologist and what excited me about this NRF2 technology, and what is my vision related to this, where we will be going in future, and why I've chosen to be a part of Life Vantage. And I just want to make a disclaimer that these are my personal views about the product. We all know that pretandem is not supposed to prevent, treat, or cure diseases, which is over there here. But whatever I'm sharing is my experience and my knowledge. And because I've worked with these ingredients over 20 years, because having active practices in India, I have used a lot of this in my practice, and how I find pretandem as a different product. So I'm going to share my views and science, and this is independent of Life Vantage. These are my personal views. So I'm just before I start sharing, I just wanted to have a disclaimer. Okay, so here we go. Have fun, because I don't think so cardiology is that much. We get all scared with heart attacks, and we all think heart means we're going to die, but that's not true, because what I found IPC Heart Care is our whole mission actually is to save people from heart attack and open heart surgeries. And because of my global initiative, I came to US and have been working here since last 4 years. So today, what Dr. Silverman told me is to share about oxidative stress, cardiovascular diseases, and how NRF2 activation will help in prevention or the people who have got heart diseases. So let's go ahead. One sec, I'll just go to the next. Little bit stuff. Yeah, I got it. So let me make it very simple, because I want this to be an education for the layman, because we all talk about heart disease. Heart disease could be like lots. It could be like valvular problems, like something like cardiac fibrosis, myopathies. But the main chunk of heart disease is actually coronary artery disease. Almost 80% of them, what you hear about people dying or a sudden chest pain and all. So what actually happens in this heart disease, and I feel it is very, very vital for each one of you to know this, because like if you look at the statistics out here, like almost 70% of the people are getting heart attack as a first symptom, and like half of them don't even survive. So I think the people who are waiting to get symptoms and then act upon are actually manufacturing the disease. And that's where I see a role of Protendum in prevention, because I feel that I'm going to share about it, that how it is going to be later on. But I would like to make this problem statement, because this is something which is very serious, that like I know Dr. Silverman is great in cancer, and she wants to eradicate cancer, and she doesn't want to give the bad news. So same way I chose to be in preventive, and I've been like almost like so many years, or more than 20 years, I've always been delivering the good news. Luckily, I chose this at the beginning of my career, because what I realized that it is the #1 disease in the whole world, almost 40% of the deaths, twice the mortality due to all types of cancer. So it is actually larger than cancer. And though US has got the best medical system in the whole world, which we are proud of, still 735,000 people are developing heart attacks, out of which 525,000 are the fresh ones. So I feel that we and our all teams and all the people here at Life Vantage have a big role to play, because there are so many people out there who are needing our help, and I'm going to share to you that how we can help them. Okay, so stay on. Okay, so what I'm going through is just a little bit what you must have done maybe in your high school days in biology, a basic like heart. We know that all, like the aorta is the main pipe which supplies blood to the whole body, and heart has its own unique blood supply, which is the left coronary artery and the right coronary artery. And the left coronary artery, one comes in the front, which is the LAD, which is also referred to as widowmaker arteries by the cardiologist, because if you get a heart attack over here, the chances of dying are very high. And one which goes behind, which is LCX. Now, why I'm sharing this is that when we talk of blockages, like what do we mean? Like, we say that the heart has got blocked, the arteries have got blocked, and what oxidative stress has role to play, and we need to understand this, so that whenever we are talking to people about heart disease prevention, at least anybody who is interested. Now I'm also going to talk about our target audience, whom we can reach and how we can reach. So just first understand the basics, that when we are getting a heart attack, which is a complete closure of the artery, it's like a warning thing, right? Like 911, hospitalization, and all the surgeries. But just look at here, like when does this disease start? The disease starts from the teenagers. They did a research like in the teenagers, and they found the fatty streaks in them. And in fact, they did studies in UK, and they found out that in the infants also, like how the cholesterol. So when we do actually a screening and we find cholesterol and all those things at a adult stage, it is not that at that point. It starts at a very young age, and the blockage keeps on developing. And unfortunately, when the blockage has developed more than 70-80%, that is where the symptom starts. So what excites me is that we have a huge window of prevention. We have got a lot of young people out there, and like people out there who are manufacturing the disease. And it's not that we have to wait for someone to become a senior and talk about heart health. I always say that prevention is from womb to tomb, and I'm going to explain you how. So what I have been working on all my life is how the blockages progress and how to reverse them, and I have done a lot of research and work related to it. I'm not going to it, but that is my passion, and that my passion to learn about this has led me to this product of Protendum. Now, if you look over here, this is how the cross section looks. maybe we can find our burgers over here or steak or a lot of stuff, you know, we keep on eating. Yes. And we don't know what's happening, right? All those like fatty food and cook and like, you know, we're just enjoying ourselves and this is what happens inside us, you know, and we just don't know. It just keeps on developing. But I tell you that people get scared of heart, but I say that heart is the best organ. Heart keeps on tolerating, you know, all the things which we do wrong to ourselves. We eat wrong food, we don't exercise, we shout, we are impatient, we are intolerant, you know, and this little guy, which is hardly like, you know, the size of a feast or 200 or 250 or 700 grams, like, you know, it just takes on all the brand, you know. And what we are seeing over here, that a stage comes when suddenly there is a rupture of that block and boom, we know that we have got an attack, you know. And I'm going to later on show that what Dr. Sveta said, that how our NRF2 activation is going to prevent all these things. So I'm going to show you a little bit on that, but I want you to get this common man story. This is what people just know that, okay, heart attack and this, but I just wanted to understand that how this develops, you know. So basically the reason why I'm here and I'm so excited that all of you are here, I think we have to attack the heart attack before it attacks you, you know. You know, so prevention is always better than cure, you know, and that is what we are here for, you know. And as Dr. Silverman said, we all have tools, you know. We know about the low fat like vegetarian diet and, you know, like managing stress, and maybe we can do yoga, meditation or exercise. But I feel that what we have, Protendum, is a great tool which helps, you know, in addition to all these things, because I'm going to share that I have worked with this for last 20 years. And when we have a tool like this, we can give such amazing results the way this science is all about. So if you go next, now, generally, I'll tell you that as a preventive person, I know all of you must have gone through this, right? When we see something like this, we get so excited, we go all out, we tell our friends, we go and talk to doctors and we talk to everybody, and they're not excited like us. And you feel so bad and you feel that, you know, like that rejection. But I tell you that just don't worry, it is all about them, you know, it's not about us. Because the problem about prevention is that very few people understand prevention. So I will just take you a little bit through the stages of prevention, you know, because one is we talk about the primary prevention, which is in young children and young infants. That is where I feel that everything should begin, you know, like we should be doing these products with our children. Like I have got my young girls, I started with them to, like, why them should we wait till they get old, you know. And especially thanks to Kerry Williams, you know, she motivated me a lot because I was thinking it is after 18 this we can use it, but she just has been using on you, Luke and her kids. So and I heard that amazing story. So I feel that we can really help young children and young adults. Then we have got the secondary prevention, and I think this is a group which will be little receptive, because I always say that what Kerry Dickey says, that, you know, you feel the person and what pain that person has or what that person needs. So when we're talking to people, high risk group, which is people who may be having high cholesterol, blood pressure, diabetes, people who are overweight, people who are smoking, you know, all these people are likely to have, you know, like more chances of getting a cardiovascular event. And I think the most receptive group is going to be the people with a heart history in the family, because there, I've always seen in my practice, you know, that many times when I have young people coming in, I ask them, you are 25, you are 30, why are you coming in now? Because I'm used to seeing old people. So they say that, you know, like my father had a heart problem, and, you know, I lost him at the age of 42, and, you know, like, I just don't want to be there, you know, so please help me. So I think what happens is that many times, yes, we want to reach out to the most of the people, but the people who are going to be more receptive to our message would be this kind of group, because, you know, they already are vulnerable and there is a possibility of an event happening. And obviously The group which is going to be most receptive is already people who have got problem because they have this nagging pains and aches, and they are the ones like if the system has not given them results, they're going to listen to anything what you say, you know. So that's what I say, that prevention is from womb to tomb. Everybody could be like, you know, we should share our message to everybody. We should not leave anyone because it will be beneficial. So what we are facing right now, as you see over here, I think we all like the movie Titanic, and you know, we all know about the iceberg. But what we are seeing here is like, you know, what we are seeing, that 750,000 people getting as a heart attack is just the tip of the iceberg. What is sitting below is this huge population over there. And I think we have a responsibility towards the society where we have to shout and keep on spreading our message. Don't bother who listens or who doesn't, but just be consistent, you know. And that is what I've been doing all my life, you know. I am just consistent in what I'm doing. I really I mean, I've lost the count of the lectures and the seminars and the kind of shows I have done and helped people. But what I see is that we should not stop doing good, because this is what we need to track. And we have a powerful product now to help us help this population. Okay, so that is what is exciting. Coming to the group, the baby boomers, the seniors, most of them have this like, you know, like incidence is almost 1 in 4, you know. So I mean, every third person you will be talking about 60-65 would be having this, you know. So this is something which you need to keep some tips with you, that most of them would have undergone a process which is like a angioplasty or a stenting. Now, if you look over here, a common man thinks that, okay, I cleared my garbage, which was a blockage. I don't need to take or do all these things because I have cleared my garbage and I have a stent and I'm fine, you know. That's what people think. And or many times they undergo the open heart surgery where they are stitching the grafts. But if you look at this, the root of the blockage is over here. So what happens over a period of time, like I have treated cases where this gentleman had done 3 angioplasties, and you know, like he was told the fourth one in the same area, the stent was keeping on getting reblocked. And I'm going to show you that how you know, like what we are doing can help this kind of people, you know, because I'm going to discuss the Ohio State study, you know. So if you look at this, or if you look at even the surgery, the grafts which are put in, you know, again, there is a reblockage over there. So what we need to educate the people is that, okay, great, you have done surgery, you're on medications, that's fine. But that does not remove the root cause of the problem. What I'm happy is that we have got something which treats and goes to the root. That is what is exciting me, you know, and that is what we have a great story to tell, you know, because these are the methods which can just like kind of, we say, like elevate the problems, but it doesn't help to go to the root, and there are chances of recurrence. Now, my journey started because I was in a country where I was actually having a great life being a hospital owner. Because once you're a hospital owner, everything rolls in, you have insurance, all the patients come in, you've got everything what you want on the earth. But what was upsetting me was, like, you know, people coming in the ICU, constant stress, burnout. And that is where I thought that, what can I do to help people stay away from hospitals? I know it is great financially, and it is great, you know, to have a hospital, but can I do something to keep people away from hospital, you know? And that's where my journey as a preventive cardiologist started, where I started teaching yoga and meditation. And I came upon EECP, which I learned from Stony Brook, New York, which is amazing non-invasive technology to open up the collaterals with the heart. So I did more than 50,000 cases with more than 95% success rate, and they feel better. But now I feel more excited that we open up the collaterals, they do diet and exercise, but we have got something which is powerful, which will help them to go to the root cause, which is always I'm finding. So let's now get to NRF2 activation. You know, this is what I wanted to share about the standard cardiology, what procedures are happening and what issues which we are facing. But now this is something which has excited me to be a part of this amazing team, that it has got very good studies. One of the biggest problem which we are facing currently in practice is, heart failure. It's really bad. Even in US also, if you look at Medicare, in fact, they have given notices that you have to manage heart failure well, because if the patient gets readmitted again within 30 days, there's going to be a penalty on the hospital. So there is a study by American Heart Association, which was published in Circulation, which was done by Virginia Commonwealth University, and it talks about right side heart failure, and it talks about how Protandim has been beneficial. So, yes, again, we are always like, we are not here to say prevent, treat or cure diseases, but what we are looking at the studies is that where Protandim is having a lot of scope, and to be honest, I am so excited to be a part of this team, because I am going to do a lot of studies in India. I want to do studies in human beings. I am going to, and luckily in India, we have got complementary therapies are accepted, and we can do case control double blind randomized studies. We are allowed to do that. And the main reason why I'm part of this amazing team is that I really want to do justice to this amazing product what we have, and I'm so much excited about it, because we are facing huge problems, and the problems which we are facing of heart failure, repeat surgeries, and there is some term which is known as what we call refractory angina. Now, what is refractory angina? Refractory angina is a group of people where they have done bypass, they have done angioplasty, they are taking medications full dose, they are not getting help. So I mean, we have so much pool of people out there who need help, and we have got amazing product, and we need to work more on it and reach out to people who could be helped by this. So another study which I am very much interested and which really took away my all attention was the Ohio State study, because my common problem in practice which I always face is that people have done surgeries, and especially you will find this more in the baby boomers, because previously when the surgeries used to happen, they used to pick up the veins of the legs, which is the graft saphenous vein, and if you look at the Ohio State, they have done it on the saphenous vein grafts, and they found out that the grafts which were treated with Protandim, then they are able to not reblock again, and even angioplasties also, if we apply the same principle, what happens is that actually technically the root cause of the entire blockage is endothelial dysfunction. Now we all understand exothelium, the skin what we have here is the outer part, and endothelium, if you just want to get a feel of it, is something which if you open your lips and touch inside, that is the endothelium. It's a very smooth lining. Okay, so same way our arteries, the internal lining is known as endothelium, and the dysfunction of that endothelium causes everything. So when even surgeries are done, that endothelium, because of the disturbance, is going to keep on producing the problem again and again. And this Ohio State study is so very relevant actually to cardiology, because it gives us a great scientific evidence that how this product is helping, to if you want to prevent the reblockages or getting the disease again, it becomes so useful. So I hope that you must have all got that message very clear. And now if you want to go more little technical, I'm sure that you must be facing people with getting cholesterol and high cholesterol, and I think everyone in US knows about the bad cholesterol, that is the LDL, and the good cholesterol, which is the HDL, and because all of us go through our meds. So the culprit in the blockage is what we call oxidized LDL. Now, how does this oxidized LDL happen? It is all because of oxidative stress. If you look at the root cause is oxidative stress, and now you understand the relevance of what we are doing, that the process from where the whole blockage formation, the plaque formation, what we call starts, is through oxidative stress. Because, and especially they have found out that small oxidized LDL particles are mainly responsible Now this bad cholesterol, that is this oxidized LDL, it goes and injures an endothelium, and it starts this cascade of lot of response in your cells, which starts leading to blockages. I'll not go into it, but just maybe if you like this, you can take a picture of this, And anyways, Dr. Silverman is doing the recording, so we'll get it. Again, coming to prevention of heart attack, that why do I'm into this? Because what you see, you look at again the plaque destabilization and blood clotting, which is the root cause of the heart attack. Again, if you look at the root cause is oxidative stress, because there is a lot of free radical activity going and a lot of inflammation happening. So when all these things are happening, it goes and makes the plaque unstable, and and that's why one of the thing is that if your blockage is stable and it has got calcification and a good cover, we say that the chances of heart attack are less. So now I think I'm very clear by now that why I'm excited to be a part of this great venture which we all are doing. And I would just like to say that I think in the Bible in 6.14, it was about the Noah's Ark, that make the ark, to save the people. So I always like that. I feel that we are making that boat, that ark, for helping people to prevent diseases or not get diseases, like the way he wanted to help people to avoid getting flooded, So I somehow feel that God has sent us to build some ark, and we have to reach out to people. I know that people are going to laugh. Some of them are going to sit and tell that, what are you doing? You're stupid. And what is NRF2 and all that? But I really don't care, because I have been speaking to a lot of my cardiologist friends. Most of them don't know, and most of them are even laughing, but I don't care, because 20 years before also they were laughing when I started preventive, but then they are all copying me at the end of the day, because what happens is that people first ridicule you, they laugh at you, then if you persist, then somewhere what happens, they start looking at you, and finally a stage comes when they want to copy you, so so with what all I've done in life, I've gone through all that stages, of right from resistance to full-blown recognition. And I'm sure that though NRF2 is something new which people don't know, but I'm sure that if we as a team, I'm very thankful to Dr. Silverman because she gave me this opportunity today. It is my honor and pleasure to be with here, and the amazing team of people which we have here to share. But what I feel is that we are doing very great work, and all of you keep your spirits high. Don't ever feel down. Whenever you feel down, just close your eyes, take a deep breath, and just remember that we are building a wonderful ark to save people. We are, because God is God. Okay, people go to church, people go to temples and all. I meditate. I feel that God is something which is within us. You can always, if you meditate and if you go to your higher self, you can always get intuitive. You'll get a lot of messages, and that's what I have been experiencing for so many years. So what I always, whenever I think of whenever I think of Protandem, Life Vantage, and whenever I think of the people I'm associated with, I've always got good vibes and good messages, from the higher self, And I feel so blessed and so fortunate that John Brooks, got me in, and Dr. Mark Gordon, and the way Kerry Williams, Kerry Dickey, Stu, everybody, worked around with me. And Hital. So we feel very great. So what I want to end is with a note that if you want to take a picture on my slides, I'm there. You can always, we are there with you. We are all one team with a major goal, of reaching out to people. So if if you have any issues, you can always reach out, and if you need any help to spread the message. I think, as what Dr. Silverman says, that our commitment always remains. So I thank you very much, all of you, for a very patient hearing. And now it's to Dr. Silverman. Thank you.
Thank you very much, Dr. Gandhi. I hope, guys, you will agree with me and support me in a notion how amazing this presentation was, how much knowledge you've gained, how much belief you've gained. And I'm not going to talk about the other products. I will just tell you one thing. In regards to cardiovascular health, the notion of us having a vitality stack, meaning that NRF2 protandum, NRF1 protandum, which is a mitochondrial boost, and mitochondrial boost is so critically important for cardiac health, for that cardiac muscle health. Then probiotic, which is critically important because surprisingly enough, unhealthy gut leads to cardiovascular disease and heart failure and heart muscle failure. And then essential fatty acids. Omegas are so critically important for heart health. So that combo, we're not going to talk about it today because we don't have enough time, but the concept of LifeVantage brings for cardiovascular health is so, so critically important. So on this note, again, thank you so much for Dr. Gandhi. So maybe next time we actually can go into stage 2 or step 2, series part 2 of our series, which is going to be mitochondrial health and cardiovascular disease.
Okay.
So now, guys, let me see. I think we have questions. Or if not, I think everybody is extremely grateful and thanking Dr. Gandhi for amazing presentation. So guys, if there are no questions, I'm going to wait for maybe 1 minute or maybe a few seconds. If there are no questions, I'm going to say thank you so much. Have a great evening. And hopefully, oh, this is a long question. Maybe not. Hopefully we'll see you in a couple weeks. Thank you so much, Dr. Gandhi. I'm looking forward to series part 2.
Okay.